really want to thank you for the honor of this award and for the work you're doing both as clinicians and as advocates for change. Basically, I'm so glad you're here at a conference addressing the issue of the real world practice of psychology and psychiatry and how it's unethical. There's no question. And based on the reporting in my book, which is a few copies are left for sale and also on Amazon, Mental Health Incorporated, How Corruption Lacks Oversight and Failed Reforms Endanger Our Most Vulnerable Citizens, as well as subsequent reporting I've done for Newsweek. And I had a cover story in Newsweek that was called, very bluntly, How the VA Helped Fuel the Opioid Crisis and Killed Thousands of Veterans. We didn't say help kill thousands of veterans, we said killed. And we had the data to show it, including the research of Amy Bollard of University of Michigan and other VA researchers. So based on all of that, I've come to some disturbing conclusions that you no doubt share, but I've dug into it in a very in-depth and investigative way to come up with the specifics and the details. So let me give you a few big picture conclusions and themes that I've emerged from my reporting, and then I'll tell you ways that we can move forward. I'm a journalist, I'm an independent journalist, I'm an investigative journalist, and a news analyst. So when I say we, I'm supportive of reform and change, but I'm describing my ideas as an analyst, not as a member of any particular organization. So it's my view, if we looked in a big way, if our nation's deadly mental health and addiction systems were imposed on us by a foreign power, they would be viewed as an act of war. Now that is a concept I took from a long ago National Report on Education Reform. And in many respects, what we're facing now in our nation's mental health system that is not being addressed at all in the current debate over healthcare reform is pretty much the same thing. And what we're facing amounts to an epidemic of behavioral health malpractice that is deeply unethical to its core for this simple reason: it violates the basic norm, first do no harm. That is not what is happening. And now, this may sound like this is an extreme rhetorical example, but if we looked at the range of players involved, from law enforcement to health policymakers to government regulators to officials to misguided and ill-informed clinicians, and we look at the horrible results that have come out, we might think, well, gee, this must be, all of them must be, sadists and sociopaths, but that's not the case at all. Many people drawn to the helping professions, of course, are very idealistic and seeking the best for their patients and seeking improvement, even though, of course, there are, extremely brutal examples, but there are many people who have been helped in therapeutic context to move towards recovery. But the system that we have now, how would it look any different if, in fact, the system is so bad now that if it was designed on purpose by sociopaths and sadists, would it look much different? I don't think so. So what we have, in fact, is what I'm kind of referred to, I haven't figured out the exact metaphor, is really a closed loop that's reinforcing and synergistic of failure, death, lack of access to quality care, suffering, and ruined lives. And of course, and so part of that is, of course, problems with access, but access alone is not the answer to the mental health and behavioral health care and addiction treatment programs. So while it is true that half of psychiatrists don't take private insurance or Medicare, and it's basically people paying out of pocket, so that means it's the worried well, as they're sometimes stigmatized and calling, but it's more affluent people are those accessing psychiatrists. And for many, of course, that may be a blessing, but some people absolutely do need quality help, and they're not getting it because the entire system is incentivized against delivering quality care and measuring outcomes that mean something in people's lives right now. You literally could not design a system that's worse to harm people than what we have. So my own introduction to this system came as a reporter in the early 2000s with 2 or 3 developments that I was covering as a reporter. I was curious, my initial curiosity came over the issue of regarding these killings of people with mental illness in the streets of Miami who were unarmed or posed no real threat. And there were a few very rare cases of people who were with severe and delusional mental illness who are not being treated in any decent way at all, who ended up killing a family member or strangers. And I wondered, what is going on? How could this be going on? And then I learned, I was plunged into the horrifying world of what's known now and then as a criminalization of people with mental illness. And my real wake-up call was when I was taken to the 9th floor of the Miami-Dade County Jail by a great reformist judge named Steve Leifman in Miami-Dade, and I saw with my own eyes mostly African-American men who were shivering and had these synthetic blue blankets around them so they wouldn't kill themselves, and all they had underneath for a bed was just metal frames because they weren't allowed even mattresses. And I went in, and many of them were, hadn't gotten any decent treatment and were speaking gibberish and angry and rattling the prisons, and it was just like, it was bedlam from the 18th century, not even 19th century. It was that primitive and horrifying. And when Judge Leifman took me out, and we were using terms then that weren't as considered as stigmatizing as they are now, he said, I don't know who's more crazy, the people in there or the people outside who aren't doing anything about it. But he kept with it, and he's led to major reforms, diversions out of the criminal justice system, and that unit is now closed down. Then I also learned firsthand early on about the opioid crisis by covering pill mills and wave of addiction in South Florida, which, as many of you may know, was one of the 2 ground zeros of it, because that was part of the Oxy Trail. The people from Appalachia would go to South Florida to get these pill mills that would just wildly give out these totally unregulated prescription drugs. Most of the people who were victimized then and now still had histories of substance abuse, and they were exploited by, we now know, these totally corrupt drug companies. But what was really an education for me was just seeing the devastating effect of addiction run amok, that nothing was being done meaningfully. So I interviewed people in halfway homes who told me about, they were now clean at that time, of things that they would do to get these pills, tear out their own teeth with pliers so they could go to a dentist and get pills, or stab themselves in their arms and legs so they can go to an ER, say they were in a fight and in pain and they needed pills. Now, what's happened as a result of this, though, is that, but since then, what's happened in response to those 2 and other issues are, what emerges initially are these very simplistic, wrong-headed solutions that are superficially appealing to many politicians, health officials, and mass media in terms of their narratives about these things. So in terms of the very serious issue of people with serious mental illness, there's now about 400,000 on any, in the course of any given day, in the jail systems. I mean, it's the solutions that were popularized for dealing with the criminalization of severe mental illness was, oh, it's so bad they're in jails, let's just give them forced medication and build more hospitals. And there's a recent book that came back where this big solution was bring back the asylums. This is now a call, bring back the asylums. And unfortunately, because of the wave of mass shootings by some people, not all, who are seriously mentally disturbed, stigmatizing is increasing exponentially of people with serious mental illness. And it is now the Republicans, who are always using it as deflection and evasion for not doing anything on gun control, are now pointing to, well, we got to deal with mental illness. Their idea of mental illness is find someone they think is disturbed and lock them up for life and give them drugs against their will. That's their solution. About the evasion of the Republicans on this issue, I have a $100 bet. If anyone can find for me a single Republican who said publicly that what we got to do instead of gun control is deal with mental illness, find one who supported the expansion of Medicaid in their state or Obamacare. I think the answer is zero. It's total hypocrisy. So unfortunately what came out, and then in terms of opioids, well, we now have the drug industry, obviously the villains of this story, and yet the solution that has emerged is still ridiculously ineffective, leading to more overdoses. And one of the key solutions is let's crack down on legal prescribing. Let's make sure that, and so people with, and I've done articles on this from Newsweek and Huffington Post, I urge you to read them, this collateral damage of people with legitimate, long-standing, often genetic pain conditions are being mandatory, immediately cut off from opioids that have allowed them to function, and they're not substance abusers, and it's dramatically increasing suicides and the risk of suicide. And even recent studies have indicated with the VA itself that increases the risk of suicide nearly 300%. So, and then of course, and I'll discuss later, the response in terms of the hardline law enforcement's crackdown and the refusal to give in any meaningful way medication-assisted treatment that can cut overdoses 50 to 75%. It's not being done. Things that are routinely invoked in the media by politicians and government agencies are the massive suicide problem we have and the overdose crisis. If it was a crisis that they really cared about, they would get rid of their archaic approaches and their old-fashioned mindsets and do what's pragmatically helpful. But you're not seeing that anywhere, at least in this country. So one of the big myths that's emerged is, oh, if we just spent more money on mental health care, everything's fixed. It's just access. We just need more clinicians. Well, all of the problems and the suicides that have occurred in the VA, for instance, have occurred even as they've increased significantly their budget and their clinicians. Now, it is true that of the 20-a-day veterans who do tragically still kill themselves, 14 of them were not regular patients or getting regular care of the VA, but that's still nothing to brag about in terms of if you're just better than absolutely no treatment at all. And nobody knows better about the dangers of medication and treatment of PTSD as it is diagnosed officially than Dr. Mary Neal Veaton, who I profiled in her book, her program Warfighter Advance. She's done incredibly important work, and it's my view, for instance, just to give an example regarding her, there were, at Penn State and University of Pennsylvania, other places wanted to study her program just to measure outcomes, and 2 universities' institutional review boards refused to okay a standard outcome measurement using data easily available. So if they really cared, and she has a remarkable recovery rate and returning to normal functioning that started in her military career, where it was 100% return to duty under her fresh approach. And I opened my chapter on her about a person who's literally going to church a few minutes before planning to go home and kill himself. And he happens to stumble into church, and there was a support group there. And it was a general support group, but a fellow veteran realized that was a veteran in trouble. And he walked over to this person, became a patient, who then said, "You got to promise me, I know you're in trouble, you've got to give her a call. You've got to give Dr. Mary Veaton a call." And he goes, "Oh man, I've tried it." "No, you have to call her. You have to promise me, man to man, veteran to veteran, you will call her." Next day, she saw him. His life has been transformed. So you would think that someone achieving that level of success, they'd be crawling all over each other to study. How do we replicate this? How can we teach her strategies? What is she doing right? Forget it. They're not interested. It's really tragic. And, I've been very supportive of the work she's done, and I urge you to read my chapter on her work. So one of the things I want to thank you all for is and now I'm trying to remind you of something, which is the other thing I learned that is still the false narrative, which is, more access and more medications, and they need medications no matter what. I didn't really realize my own mother died in the mid-90s in a psych ward due to probably overmedication. We were not actually, I wasn't even aware of the issue of overmedication, and I wasn't even yet reporting on the mental health system. And my mother was hospitalized with delusional depression that occurred late in life. There was a lot of stresses, a new grandchild, and stress of moving out of the home sort of exacerbated. She had problems, but did not have things like, schizoaffective disorder or delusional depression. She was hospitalized, so she fell out of the bed and cracked her skull on the hard floor in the unit, and then went into a coma. And then our family was struggling about what to do, and there was reluctance on the part of my father, who later passed away, to, remove life supports. But I realized later, wait a minute, I haven't still gotten the full medical records. She was undoubtedly on Haldol, would have been on the strong antidepressants of the day, the first generation, tranquilizers, and the general, let's keep them quiet and sedated. And then obviously no one's paying any attention to dizziness and sedation, and she's dead. Now, I wrote an article about that for Newsweek that's then been reprinted a few places. And however, I found doctors who do sensibly prescribe medication. So my takeaway from that isn't never prescribe psychiatric medications to anyone for any reason. I learned subsequently there are people who approach it in a sensible way, and that's my personal view. I'm kind of a centrist on that issue. But what I'm trying to say to the work you all are doing and have done for years is you have been at the forefront of highlighting issues related to overdiagnosis, overmedication, and the still futile search for the mystical, chimerical, biological markers that will someday help you all solve the problem. Well, that hasn't happened yet, even though there's probably some genetic data that might show it could happen, but it hasn't happened yet. And you have, people like you and your allies have already made some differences and beyond your day-to-day practice. So there's a new book out by Ann Harrington called The Mind Fixers that is an in-depth, deep critique of the search for biological cures and solutions that got, rave reviews and a lot of attention. And remarkably, Bob Whitaker's work in Mad in America and Anatomy of the Epidemic, and his advocacy, his journalism, and his website, and which is basically synthesizing the best research, ultimately is convinced and created real questions. Do we need long-term antipsychotics, even for people with schizophrenia? This is now, when Tom Insel, the then head of NIMH, publishes an article raising questions about long-term antipsychotic use, Well, that's a sign that ideas that had started percolating with your organization and like-minded people years ago is filtering up and making a difference. But what we're facing now is so serious and so deadly that so much more needs to be done, and needs to be done now. So part of what I want to convey to you, and I admire your organization and all the work you're doing, is that we need right now all hands on deck, pragmatic, alliance-building response that goes well beyond just meeting in a hotel room in Baltimore and discussing problems that you guys have identified for years. We are in a crisis, and what we are facing is essentially a hellscape. The hellscape is our nation's mental health and addiction systems, and it's producing, as you've seen periodically in investigative reporting by others and me, ProPublica, my book, others. We have so many examples of neglect and abuse that are exposed, but they will not be fixed in the parameters of the current debate over Medicare for all or expanding Obamacare. And I think that there's a way for all of you to form alliances and build support for broadly accepted goals, even though you may have philosophical differences with potential allies who may not share, let's say, what is deemed a radical view about the medical model. There's so much wrong that you guys were out there out front working on that you can now bring your knowledge and expertise. And let me just, these are kinds of things that are in my book and in my magazine reporting. So, and other journalists as well. So we have a system where a common approach to people who are hospitalized for severe mental illness is kick them out when the insurance runs out, and it's called bus stop treatment. Give them a ticket to their hometowns, and it's kind of like a parody of Mel Brooks and Carl Reiner's International Society of Psychiatrists, goodbye and good luck. That's how they treated, that's a sketch. That's reality. And a UHS facility in Texas did that. They brought the guy who didn't have any more money that they could rip off, put him on the bus stop, goodbye, good luck, walked away. Next day he jumps off a bridge and kills himself. They did not care. There was just money to be extracted, and the patient died. So what? Collateral damage. And one thing I need to stipulate here, very important for me to stipulate, is all of these are allegations. When I mention a specific company or clinician or health agency, these are allegations contained in lawsuits and investigative articles. In almost all cases, there's been no legal or criminal finding of wrongdoing in either civil court or criminal court about any of these actions. And in general, the companies have never acknowledged or admitted wrongdoing. So even so, there's a large volume of serious allegations that I've reported on, but I need to stipulate that. So one of the other things is I want all of us to think about these statistics that we hear over and over again, so they don't really, at this point, really add up. They just, you read them about suicide and this and all opioid deaths, and they're just statistics. But I want you to think about them as icebergs. And we have our nation's mental health and behavioral addiction system is the Titanic. And what these statistics at the very top line are the icebergs representing the deep rot throughout the system underneath. So I'm going to remind you of some statistics you've heard. However, it's important to realize every one of these numbers means an individual whose life was destroyed. And it made me sometimes in all my reporting about depression and suicide, I would think I don't have an issue related to serious depression, or, I may have anxiety and different issues, and I've been down, but I've never seriously contemplated, no matter what's happened in my life, killing myself. So it's important for, obviously, people who are clinicians deal directly on a day-to-day basis, like Dr. Kirsch and others, and many of the clinicians here with people who are actively suicidal. But for the general public, and it's just a statistic, and you might read a horror story about a suicide, but I think if we think seriously about it, how bad must it have gotten to actually attempt and then kill yourself? And that's when these numbers jump out at you. There's roughly 40,000 suicides a year, and 2/3 of all gun deaths are suicides. That's not generally part of the national debate over gun control. And then if we look at the drug overdose figures, which are widely popularized, deservedly so, we have more than 72,000 people died from drug overdoses in just one recent year, 2017. Well, that's more people than died in all of the American soldiers that died in Vietnam, Afghanistan, and Iraq put together. Well, that is pretty serious. And obviously what's happening is most of those deaths are arising from illicitly obtained opioid pills that are legally manufactured but are obtained illicitly, and then heroin as the prescription. It's harder to get diverted in illegal prescriptions, heroin, and then it's dramatically increased with the importation of this counterfeit fentanyl that's just this highly deadly substance that's being laced into counterfeit pills, laced into heroin, and it's just, and there's even misreporting about that. There's myths that if you touch 1 grain, you'll die. It's not true. I mean, that is part of the reporting that's going on. There's writers and journalists who challenge that and urge you to read the work of Maya Szalowitz, Leo Beletsky, Zach Siegel. Leo is a professor. But they're people who are pointing out these myths that are not helping us solve the problem if we're buying into false narratives. And I think that cuts across all of the mental health, addiction, behavioral health, and troubled teen industries. So here's an example that proves this point. So there was a recent study that came out quite important where among the most definitive recent studies looked at what actually was causing the deaths of overdose victims. Of course, they found multiple medications. But there's a Massachusetts study that just came out like literally earlier this month that showed they used the PDMP, the prescription drug monitoring programs, death certificates. They found that only 1% of the overdose deaths that they studied had chemicals in them that they were legally prescribed. So what sense does it make to cause horrifying torture of people's lives if it's not actually going to affect? So while actual prescription drug prescribing has fallen pretty dramatically legally since 2012, overdoses are increasing at 30% a year. Now that is really something that people should be alarmed about, but they're alarmed about the deaths, but the government, policymakers, and media in general aren't looking towards things that might work. So, and then of course, an example of, I mentioned earlier about the 400,000 seriously mentally ill people who are, are confined in jails on any given day. And I exposed a cover-up of a death of a woman named Unique Moore, who had a history of schizophrenia and drug abuse, and she was in the jail, and they basically ignored her screams. She needed to have for asthma, she needed to have an inhaler. They wouldn't give it to her, and the people who were the guards in the women's jail, they were just chatting, schmoozing next door in another unit, and the screams were going on from the cellmates, and they were ignoring them. And then for a year afterwards, they were covering it up. They wouldn't even admit she died. And it's not surprising. This same LA County Department had 21 people convicted of corruption and violence from the sheriff on down, and most went to prison. So that's, And part of what they did that was so wrong is they had organized gangs of sheriffs beating up mentally ill people, and they would use that as a test. Are you willing to go into that cell and beat up the mentally ill person there or not? And then they would use that as a test, as like a gang induction test. And then it later emerged that some honest sheriffs who were law enforcement decided, no, I think I'll quit. But the way they got exposed initially was thanks to the very active ACLU of Southern California, is they were so out of control and so arrogant, they were beating up in front of a priest and an ACLU observer, in front of them. They were beating them up. So, and then we have the issue, and then I'll move to some solutions here, is we have the issue of what is still a major problem that isn't addressed. One is that 15,000 people, senior citizens, according to FDA estimates, are killed each year from over-medication with antipsychotics. And yet, nothing meaningful has been done about it. And that's the equivalent of, this is just for rhetorical sake, that's the equivalent of 5 9/11s every year for senior citizens. And there's nothing meaningful being done about it. And Human Rights Watch just came out with a report that 179,000 residents with dementia each week are exposed to chemical restraints. And essentially, CMS has tried to cover this up, and they had a partnership with the nursing home industry with a lot of fake data that they generated, and this is available on the site of Center for Medicare Advocacy and has also been reported in JAMA. They basically claim there's a 1/3 downturn. Well, how did they get that magical 1/3 downturn in antipsychotic? Well, they didn't count on-label prescribing. So what happens? Oh, guess what? Loads of senior citizens are now classified as schizophrenic by the nursing home industry so they can continue to drug them and chemically restrain them. And then we, of course, have the off-label problem that is so horribly depressing, which is 60 million antipsychotic prescriptions are written a year, and many as 75% of adults get them off-label, and 90% of young people get them off-label. And even today, 20% of anxiety patients going to psychiatrists get antipsychotics. This is so insane. And then this is allowed to continue because the drug companies continue with false marketing, and they get these meaningless, it may sound large to us, but if AstraZeneca got a $520 million fine for off-label marketing of deadly Seroquel, well, Jesus, if you're getting $5 billion a year for 17 years, or $5 billion a year at its peak, what does that mean? It's chump change. My knowledge, and then what they have is these repeat violations. They do the same things over and over again. They have these meaningless settlements when they sign corporate integrity agreements. So I actually called up the HHS Inspector General's office, got a spokesperson on the phone and said, have you ever sanctioned anyone who violated a corporate integrity agreement? And he said, this is like a Jack Benny level pause. He went, let me get back to you on that. Like a few weeks later, he told me about a decade earlier, one company was fined for some minor violation at $3,000. Oh, $3,000 is really going to scare Pfizer, AstraZeneca, Johnson & Johnson, right, from ever violating their corporate integrity agreements. So basically, it's my view that there's things that you all can do right now in terms of promoting things that work and forming alliances, and I just want to run down some of those issues. The other issue that's totally not addressed at all, except for an occasional scandal, is the scandal of the troubled teen industry and institutionalizing kids in all sorts of settings. As many as 200,000 are being institutionalized, and I've covered deaths and torture and neglect, and it's repeated over and over again, and they're essentially unregulated. And I did a story about one such facility in Alabama that was a fundamentalist tough love program, and as a result of my work in ABC, they passed the toughest regulation of these kind of facilities. But we all can agree that a lot of these horrible practices have to be stopped. So what can people who of good faith know so much can do? And I have some ideas for you to consider. So one of the things is to look at to look at it in this way, treatment as usual is a disaster, but reform as usual is equally disastrous. So regardless of the philosophical differences you have among each other or with other organizations who are trying to make changes, I think it's really important to form alliances, reach out to legal organizations that have a track record of filing successful lawsuits, and provide them with cases and examples that they can use for further class action, work with victimized patients to help get such lawsuits going, and work with the peer community that knows these issues the best. They have such a deep well of knowledge, and their knowledge and their experiences are so important. They need to be incorporated into much of what you do in terms of advocacy, and make sure you're forming partners with them. So one of the things is to try to approach what used to be called years ago a big tent approach, in where if people can generally agree on the notion of humanistic care, that should be sufficient to try to form some alliances. And let me give you names of groups that are very much in your spirit if they don't agree on every little detail of your philosophical views. There's groups like the Farmed Out Conference, run out of Georgetown annually by Professor Adrian Few Berman. Absolutely worth networking with, going to those events, sharing information with them. The Lone Institute is promoting a right care approach. They're based in Boston, and it's trying to they're working off of some of the philosophy of author Shannon Brownlee, who wrote a book about overtreatment. And there's those people. Then we have Kim Woodsack, who's worked on the Woody Matters program, which is kind of off of her husband's needless death from antidepressants, and she became part of an international campaign that got a lot of signatories worldwide that needs to be revived. But it has a lot of lessons to be learned. It was called the Selling Sickness Campaign, and it was a way of forming alliances of like-minded groups that were working for change. And then I do think, though, one of the key things is to try to get the word out about programs and treatments you're using that are effective in making a difference, and at least have some evidence beyond your say-so and anecdotal accounts to make the case. Because the thing is, it's my view that you can use the successes that you've already achieved, evidence that you're developing and have developed, and you know firsthand the dangers of the patients who come to you after they've been totally damaged, if they're still alive. And there are organizations that will care about that if presented in networks, such as the Children's Defense Fund. So Marian Wright Edelman has written about issues of over-medication, but that hasn't done as much about it. And ironically, her sister-in-law is Toby Edelman at the Center for Medicare Advocacy, which is the leading national organization critical of antipsychotic over-medication, and a valuable resource. So it's, in terms of lawsuits, a group like Children's Rights has effectively filed lawsuits against foster care systems, leading to meaningful reforms of reviewing the kinds of medications and trying to stop it when unnecessary. And then there's the model lawsuit about the outrageous, fraudulent, and needless payment for off-label marketing, which in Medicare and Medicaid laws and in judicial decisions has been declared as fraudulent. That's why they filed the lawsuits. But when I was doing reporting about, hey, it's in the law, they actually told me that the people at CMS told me they didn't have the authority, they said, to even tell state programs that they could stop paying for completely off-label, unproven treatments of drugs, meaning there's not a shred of evidence in any pharmacopoeia. Literally, that's fraudulent. People have had settlements about it, and yet CMS won't do anything about it. You don't see a hue and cry about this among media or groups that could make a difference. AARP has slowly moved along but hasn't done nearly enough. So one of the signs of the big tent, and so I'm talking about alliances, a very welcome sign that may seem small but to me is very important. Robert Whitaker's Mad in America is doing a new continuing education program. Now, one of the people who is teaching one of their seminars is the great Dr. Robert Drake. He was the founder of the Dartmouth Psychiatric Center. He is a leader in effectiveness programs and effectiveness research and is the co-developer of Supported Employment, this completely underused program for helping people get and achieve competitive jobs and hold on. And the first time I met him, this is in the early 2000s, I was at a meeting about evidence-based care, and he grabbed my arm, and he looked at me directly in the eyes, and he said, "Art, the best mental health treatment in the world is a job." And he was been a forceful advocate. He uses medication in a judicious and appropriate way, and now he's giving a course under the aegis of Mad in America. Now that is a big tent approach that ought to be emulated in the kind of alliances you form. Similarly, with suicide, there is some progress made, and and there's obviously the risk of over-screening, over-medication in suicide prevention. But there are some programs that approach this intelligently and have led to some thoughtful developments of what's called the Zero Suicide Initiatives. And they actually worked, and I write about it in my book. It's the HMO, the Henry Ford HMO in Detroit, had nearly 3 years of zero suicides in an entire patient base of nearly 200,000 people. And today, even though there's some suicides, their rate of suicides among their mentally ill patients is 98% less than the national average. Now that is something, now they of course will do things that to people who are concerned with the medical model and over-medication, oh, you're going to have teen screen, you're going to drug everybody. Well, it's not necessarily the case if they approach it in an intelligent manner. And that's what they've done in that case, and it's trying to be replicated. So it's finally what I'm trying to convey to you is that you know practices that work, you know the unethical dangers that have to be halted, and it's really time to use your knowledge, your professional background and expertise to spread the word to influential advocates who are, I believe, waiting to hear from you and can be educated. And so you will have the opportunity to finally make ethical treatment a real possibility in people's lives. So thank you very much.